Public healthcare has been a constant re-emerging topic of contention within United States politics as far back as I can remember. It is a topic of contention in the current election cycle and will in all likelihood be in future elections again. Watching this American debate as a European living with such a healthcare system, there is however something that has always been strange to me, which is that not one proponent of such seems to have an idea of what it is, how it would work, how such a system would be built, and what it would require from everyday citizens as well as society at large. Most American proponents of public healthcare seem to get their idea of what it is and how it works from a Michael Moore movie, a movie that does an absolutely awful job at presenting the systems we have in European countries. All it really does is show us English and French doctors and nurses proclaim how superior these countries' healthcare systems are, and that's pretty much it. But there's far more to it than that. Those two countries have vastly different systems and are more on the extreme ends of what public healthcare is. Especially giving England as an example of a great public healthcare system is somewhat ridiculous, because the NHS, the National Health Service in the UK, is one of the worst healthcare services in Europe. Created during the 1950s in the post-war consensus, an age of massive centralized government organizations and public spending, the NHS was plagued from the beginning with a massive entangled bureaucracy. Detangling and reorganizing the system during the 1970s barely fixed the problems. Things were made worse under the Thatcher administration through the introduction of a management system intent on cutting back costs and increasing efficiency, and substantial damage was done to the NHS by the government of Tony Blair. He believed that a public service could be run like a private company despite having no market competition. His government introduced a system of quotas and standards meant to artificially replicate market pressures. This was meant to make the overall service more efficient, but in the end accelerated its declining quality. Subsequent British governments have done little to resolve these issues. Not all is bad on the British Isles though. In 1999, Scotland retained control over healthcare legislation from Westminster for the NHS Scotland. They avoided the Frankenstein reforms Tony Blair forced on England, created their own institutions, smaller bureaucracy, centred around 14 local health boards run by officials specific to manage these regional healthcare needs. Overall, Scotland's public healthcare performs better, and giving England as an example to Americans of how a public healthcare system is supposed to operate and work is just a giant misconception and misleading. England is an extreme example, and it is more of an example of how not to do it. France is on the opposite extreme. The services look amazing to foreigners, like the fact that every mother gets a nurse assigned to her by the government to help her out through the first 2 to 4 years of motherhood, until her kids are old enough to go to kindergarten, which, in France, is also government funded. But what Michael Moore and others who praise the French system don't show you is the enormity of costs and the size of the apparatus behind this system. France, on average, spends between 12 to 15% of its national budget on its healthcare system. Every French citizen is required by law to pay into a national health insurance fund, the amount of the fee being determined by the individual citizen's income. France also has taxes, for example on gambling and casinos, the revenue of which specifically goes straight into the National Health Insurance Fund. The system, which is centralized and run by the Ministry of Social Affairs, Health and Women's Rights, only works due to the massive amount of funds and resources allocated by the French state to ensure its viability. It works because the French are willing to pay the taxes and fees required to make it work. And this is where we go from Americans having wrong impressions about public healthcare to their understanding of it being also somewhat flawed. Because the debate about a public healthcare system is about far more than silly pedantic meandering over whether or not it's communism. It's a debate over structure, taxes and social sacrifices made, as well as burdens upon the individual or society at large. Whenever I saw a Bernie Sanders or other US politician continuously talk about how much they want a public healthcare system, the only thing they ever talk about is how much they want it, how great it would be for everyone, but never about what it means for the country and how it would be structured, built or implemented. There are simply questions, however, that must be asked, like is the US government even willing to allocate 12% to 15% of its annual budget into such a system? How well would it bode with ordinary US citizens to levy additional taxes from them for such a system? Because the bottom line remains that taxes paid to ensure the functioning of such systems in European countries are not just levied from super rich, no, they are paid by everyone. So in the end, this is a tax burden that will come down on ordinary working people just as well. And if you do not have this conversation as you campaign for public healthcare, you will eventually be forced to having this conversation when you try to implement it through the legislature. Beside the financing and taxation aspect of public healthcare, there's an additional aspect never talked about in the US political debate. If you are an American and you have ever been to Europe, you may have noticed that Coke tastes different here. It's less sweet. The reason is that our governments regulate the contents of sugar and take an interest in how healthy or unhealthy the produce we consume is. Some countries, such as the UK, even have a sugar tax. Denmark has a tax on fat. Most European countries have high tobacco tax. Sweden has a very high alcohol tax. European countries have the strictest regulations on food quality in the world. Even beyond just the simple what we eat and drink, it is also how we buy that is regulated. The UK, for example, banned the advertising of candy and sweets using cartoon characters or any other advertising method that specifically targets children. Outside of food, there are government incentives and initiatives to keep citizens healthy, from subsidized fitness and sport initiatives down to extensive fitness programs for school kids. Why? Let's leave Europe for a great example for why. Japan has a public healthcare system. It is one of the best healthcare systems in the world in terms of quality and efficiency. Japan is also the country with one of the world's best healthcare systems that spends the least money on it, because Japan also has the healthiest population in the world. Once you have a healthcare system that is financed by taxpayers, the taxpayers, and by that extent the government, have a vested interest in the health and well-being of the taxpayers. Or rephrased, if you are morbidly obese in the United States, it is your responsibility, or should I rather say, your lack of responsibility. It will reflect itself within the costs you pay to whatever insurance company you sign up with. You pay the consequences, not just in diabetes and cardiac arrests, but financially. In a country with a public healthcare system, if you are morbidly obese, costs for your resulting treatments are paid by other people's taxes. It is consequently no longer just your responsibility. If you are fat in a country with a public healthcare system, you are a burden on society. And there's a question to be asked and answered of whether the people of the United States can even put up with such a standard. Personal responsibility and independence is at the core of the country's identity. Seeing your actions and your life within the wider framework of how they impact society at large is not necessarily something attractive to many Americans. Additional taxation on unhealthy produce, as well as a government-sponsored and encouraged incentive to live healthy lives, is also something that most Americans would probably not even accept. A few years ago, the former mayor of New York, Bloomberg, attempted to ban the biggest-sized soda bottles in measures intended to incentivize healthy living for New Yorkers. New York, being a place that will probably be pro-public healthcare, protested that measure substantially to the point that it was rejected. However, in a conversation over whether or not to have a public healthcare system, such measures are part of the conversation that are simply unavoidable. Yet the proponents of public healthcare in the United States don't ever discuss this. American politicians who argue for public healthcare only ever say that they advocate for it, but never actually lay out any policy plan for how they would finance such a system or even what such a system would look like. But also more crucially, how they would incentivize Americans into being healthier. And that is an important conversation that must be had, especially when you keep in mind how unhealthy the average American is. A public healthcare system is not intended to be a daycare for obese people to continuously even out the consequences of their irresponsibility. And if you introduce a public option without incentivizing a healthy public, that is exactly what your healthcare system will turn into. I personally don't believe a federal centralized public healthcare system like in France would work in the United States. The country is too big, the bureaucracy would be too large, the taxpayers unwilling to pay, and the political landscape unwilling to put up with such. In France, there is a consensus amongst both sides of the political aisle to ensure the healthy state of their healthcare system. That bipartisan consensus does not exist in the United States. If a Democratic president were to introduce it, it would only exist until the next Republican president comes into office. Additionally, I don't believe a centralized federal healthcare system is even desirable. The system I prefer the most is one you got a taste of in the beginning of this video. Countries such as Germany and Austria employ a system in which healthcare is federally mandated and even subsidized, but implementation of the system is largely handed over to the individual states. I don't believe that a top-to-bottom federal healthcare mandate would work in the United States, and what I would propose to Americans who wish to have such a system is to abandon the idea of a federal public healthcare program. The legalization of cannabis cannabis shows how reforms are best implemented within the United States, namely through legislation in the individual states to then convince those in other states of the viability of the reforms. I believe it would be better for the American advocates of public healthcare to campaign for public healthcare in their home states through state legislature and the governor's office. Not only are such efforts more likely to bring results, but would also achieve a public healthcare system without the consequent possibility of having the federal government step in and dismantle it if those in power of it oppose it, as the centralized British government would have done to Scotland if they hadn't retained control of their healthcare service in 1999. Such a regional system is also more efficient and more in touch with the people within the comparably smaller state it has to serve, and the advocates of a public healthcare system would also be more in touch with their own communities, and therefore it would be easier to debate and implement subsequent other measures incentivizing healthier living and finding the revenue source for the system.